A weekend curfew has been announced across India's capital to curb an Omicron-driven COVID-19 outbreak. New Delhi is also making it mandatory for government officials to work from home. Private offices will also have to make half of their employees work from home as well. Only essential workers are exempted. Buses and trains will continue to operate at full capacity, but masks will be mandated on board. Further restrictions are also being discussed. Depending on hospital bed occupancy, COVID-19 cases in India have been climbing since the start of the new year. There are over 37,000 fresh infections. That's the highest in around 4 months. The Omicron tally, meantime, has nearly hit 1,900, with Maharashtra and Delhi accounting for the majority of cases. For more insights, Associate Professor Sanjaya Senanayake from ANU Medical School joins us now for more. Professor, Omicron cases are skyrocketing all over the place. Some countries like the United States and Spain, though, they're cutting their quarantine period requirements. What does the science say?
Yes, Dawn. Well, I think a lot of these decisions are pragmatic ones, taking into account some precaution, because they find, and we found in Australia as well, that our testing resources for PCRs are being overwhelmed by the amount of infections and the people seeking to be tested, and also people being furloughed from work. So workplaces such as hospitals might not have enough staff to run vital services. So for this reason, and the fact that Omicron seems to be milder, particularly in highly vaccinated populations, we've gone to reducing these quarantine rates or these isolation periods. We do know from the science that most people are most infectious with COVID around 2 days before they get symptoms to about 5 days after. Now, beyond that point, they still can transmit COVID, but most of the transmissions happens in that 7-day period. So trying to cut one's losses, being pragmatic and being precautionary, a lot of countries have come to this conclusion.
Professor, we find a silver lining again from science. And what science has shown us, several studies over the last week showing Omicron, as you mentioned, more transmissible but less severe. And of course, what you might be looking at if it spreads across the world is widespread infection, few deaths, and therefore resulting widespread and profound immunity, essentially a sort of global natural vaccination program. Is this too positive a reading?
Look, every cloud has a silver lining, even a cloud of contagion. So you've correctly highlighted those possibilities in terms of Omicron being less severe. It definitely seems to result in less hospitalizations than Delta. And we've seen that even though the vaccines are not as effective as at preventing hospitalization as they are against Delta, the vaccines nevertheless are still very effective. So we know that 2 doses plus a booster at about 2 weeks after the booster prevents 88% of hospitalizations, and even 6 months after 2 doses of a vaccine, you've got about 50% protection against hospitalization from Omicron. So those are pretty good odds. So in a highly vaccinated population, Omicron spreading through it is not the end of the world. But of course, the problem is with very large numbers of infection, even a small proportion being hospitalized can be a large number and can overwhelm health systems. So that's why everyone is a bit on edge at the moment.
Professor Senanayake, countries are essentially doing what they need to do. They're calibrating their measures according to what their virus numbers are like. Some are reinstating these strict curbs. Others are still pushing ahead with reopening. Is there a specific way to go? Is it going to be sort of tailored towards the conditions within specific countries?
I think so. As we were saying at the start of the interview, a lot of the measures that people are taking now with Omicron, governments are taking, are pragmatic ones, looking at how dangerous Omicron is and matching it with the resources and whether they're being overwhelmed within that particular country. And we also know that coronaviruses, SARS-CoV-2, will act more aggressively and more efficiently in winter conditions. So the Northern Hemisphere may have a different tack to the Southern Hemisphere, irrespective of whether they're developed nations with high vaccine levels. So everyone will do things slightly differently.
Professor, a final question for you. Doing things slightly differently, you have publicly advocated for a more pragmatic approach to managing Omicron, saying that previous measures were targeted at Delta, which was a different strain altogether. I mean, it was related, but it had different effects. Now, how can governments adapt their COVID-19 measures so that they not just adapt to Omicron, but there will be other strains in the future? How do they do that, reduce disruptions, even as new variants emerge?
Yes, that's right. So if hospitalizations are becoming less of an issue because a variant is less virulent but more infectious, then we will have to tailor things differently. So I think one important example that we're seeing in many countries in the world is the uptake of rapid antigen testing, because a lot of countries have only finite PCR capabilities. We know that rapid antigen tests are very good. They're perhaps not as sensitive as the PCR tests, but when you've got so many people needing to be tested, having rapid antigen tests at home and ideally being freely available, so certain parts of the population don't miss out, will help make it a more efficient system where we minimize transmission of infection. So I think that's a really important step. And the other thing we have to do is, even before Omicron, even when we were just worried about Delta, using masks indoors when we couldn't safely socially distance, using QR codes when we go to a venue so we'll know if we've been identified in a potential outbreak. All those things we have to continue doing, and they're things we've been practicing for the last 2 years.
Professor Senanayake, thank you. Associate Professor Sanjaya Senanayake there from ANU Medical School.